It gives us an opportunity to have patients see a specialist that we don't have on our staff. We can usually arrange these in a short period of time, so hopefully within 24 hours we could get a specialist that the patient might need to actually see the patient on video. We have the ability to let them examine the patient with a lot of devices, including a stethoscope to listen to their heart and lungs. We can get the specialist to have all the information we have so they can see all their vital signs, all their lab work. They can actually see all their x-rays because we can send those electronically to them and they can view them ahead of time. We can provide data like EKGs, echocardiogram reports, so that they have actually a full armamentarium of what the patients have done. But it gives them a chance to actually talk with the patient so they can do a history of the patient. They can do at least a limited exam, although a fairly extensive exam. Either our nurse and or I would try to attend these interviews so that if they want us to examine an abdomen or feel a pulse in the foot or something, we could do that for them as well. And at the end of all that, we usually get a fairly quick opinion about what they think about the patient's problems and what could be done. And so far, we've gotten a very quick written response as well too, so we get a written report about what they think. And they're usually willing to do follow-ups as needed. So it works out to be a good experience for us, but a good opportunity for the patient to not have to travel somewhere. Gives us a chance to keep people in our own hospital who might need the help of some other physician that we don't have on staff. This actually is done by TV, so we can actually see these people on a TV screen. Somewhat like Skype, although I haven't done Skype for a while, but Skype used to not be very reliable and you couldn't see us very well, but this is a more sophisticated device, but somewhat that same idea, yes. The one we did actually worked very well. It was easy for me. I made the decision we needed to do this, offered the opportunity to the patient. The patient was very willing to do that. Our nurse, Jolene, actually did all the legwork, set it up and got it all arranged. It worked within probably less than 24 hours. I think we did it the morning after we made this decision. Actually, everything was ready to go. When I entered the room, I wanted to attend this because I wanted to see how it worked and I wanted to see what the doctor thought. The doctor was Dr. Bakir, who is a pulmonologist in Springfield. He saw our patient, did a very nice job, gave us a lot of helpful information, and actually the patient was able to benefit without going out of town, and ultimately the patient was able to have an outpatient follow-up with him, I think, as well too. Easier for the patient, but also better for us as well. The more we can do here, the more we would prefer to do here. And this patient was not in any deep trouble, but had some things that I couldn't answer in terms of questions about his disease or questions about where we needed to go. They had asked about a pulmonologist, and the light went on in my brain saying, hey, we can get a pulmonologist to come to you. And so that worked out very nicely for us. So we have the technology to do this, and we have the people, at least we have some limited people trained to do that. We can always expand that training. We have to get physicians attuned to the fact that this is available so they start thinking about this as an option. Rather than getting on the phone and sending somebody somewhere, let's get on the phone and bring somebody to the patients.